Next, use of modifiers to clarify procedures. Introduction. Modifiers are essential tools in CPT coding that provide additional information about a procedure or a service without changing its core code. They help clarify circumstances, convey special circumstances, and ensure precise billing. This module explains the purpose, proper use, and guidelines for modifiers to enhance code specificity and reimbursement accuracy. Purpose of modifiers: add detail to specify variations of a procedure, such as bilateral procedures. Next, correct errors to indicate when a procedure was altered or performed under special circumstances. Next, improve reimbursement to prevent claim denials and adjust payment levels based on specific situations. Ensure compliance to accurately reflect services according to documentation. Next, types of modifiers. Category 1, modifiers 0 to 25. These are most frequently used and apply to CPT codes. Category 2 modifiers. These are supplemental tracking codes for performance measurement. Category 3 modifiers. These are temporary codes for emerging procedures and technologies. Next, commonly used modifiers and their applications. We'll review modifier, its description, and typical used case. Modifier 50 for bilateral procedures. The typical use case is same procedure performed on both sides of the body. Modifier 51 is for multiple procedures. Typical use case is additional procedures performed during the same session may be paid at reduced rates. Modifier 59, distinct procedural service. And the use case is that procedures that are separate and distinct from others. This is often used to unbundle services. Modifier K, description is anesthesia by surgeon. And the use case is when surgeon provides anesthesia, not an anesthesiologist. Modifier LT and RT. The description is left or right side. Use case is that laterality indication for procedures involving one side of the body. Next, guidelines for correct modifier use. Support with documentation. Use only when supported by clinical notes or operative reports. Apply appropriately. Use the most specific modifier applicable for the situation. Avoid unnecessary modifiers. Do not add modifiers that are not supported or not permitted as per guidelines. Check payer policies. Some payers limit or restrict modifier use Verify with payer-specific rules. Next, when to use modifiers. To indicate procedures performed on bilateral sites. To specify distinct procedures during the same operative session. When procedures are altered, reduced, or when unusual service circumstances occur. To provide additional details like anesthesia, provider type, or service location. Next, common pitfalls and best practices. Overuse or misuse. Incorrectly using modifiers to initiate billing can lead to audits or denials. Omissions. Not applying necessary modifiers can result in underpayment. Next, documentation gaps. Lack of supporting documentation weakens the justification for modifiers. Key takeaways. Proper modifier application enhances billing accuracy and reimbursement. Always support modifier use with detailed documentation. Familiarize yourself with payer specific rules regarding modifiers. Use modifiers as an extension of procedural notes, not as an afterthought. In summary, modifiers are powerful tools in CPT coding that clarify and specify procedures and services. Correct usage improves claim acceptance, ensures appropriate compensation, and maintains compliance with coding standards. Mastery of the modifiers support professional coding practices and effective revenue cycle management. Thank you.